Hi there, and welcome to Elevate Women's Health Center. I'm Dr. Shauna Dingman, and today I want to talk about something that is really important for all of my moms who have ever had chronic low back pain or that nagging low back pain that sometimes it's really low grade, but it's just there all the time. And it starts often either through our pregnancy or after we have kids. So if that's you, I want you to know, first of all, I can totally relate. Even though I'm a chiropractor, I've had 3 kids, and I had that kind of, it was just a nagging pain that was there. It wasn't enough that stopped me from doing what I wanted to do. So I just kind of ignored it and kept on with things. But by the time I was about 45, I thought, okay, enough is enough. I got to deal with this. And so what I learned was that what was going on with my pelvic floor was it was the key to unlocking getting rid of that low back pain. So the pelvic floor, it's like a hammock. It looks like this, and it's down here, and it supports your bladder and your uterus and all the bottom of your pelvic organs. And what happens is, you can imagine as you're pregnant, that begins to sort of stretch and fall. Well, if you picture a piece of gum, you know when kids chew gum and they kind of take it out of their mouth and it goes like that, it doesn't come back to its original shape again, unless, in the case of your pelvic floor, you actively work on it. So I had done lots of core strengthening, tons of working out, lots of CrossFit and crunches and Beachbody and P90X. I had done all that stuff. So I thought I had a really strong core, but what I hadn't done was specifically address my pelvic floor muscles. So finally, I learned how that works. And what has happened for me is, in strengthening the pelvic floor and bringing it back to its normal shape again, I assume it's its normal shape, I don't actually know, but I don't have that nagging low back pain anymore. And what a difference it makes. So now I'm recommending this for all of my patients that have low back pain. And really, I've got patients who have just had kids and they don't have low back pain, but they're postpartum. And so I'm already recommending this as a means of making sure that this doesn't happen to them. And really, there is a technique for engaging your pelvic floor, and that's what I want to show you today. So all I'm going to do today is just show you the proper technique for engaging your pelvic floor, and in a later video, I'll show you some pelvic floor exercises that you can do. So what I do to begin with is, you can see I'm sitting on a yoga mat, and I'm actually sitting on a pillow here. It just lifts my sit bones. So your sit bones, those are the bones that you feel when you're actually sitting down. We tend to sit in a very slouched kind of posture, and what happens is your pelvis goes like this. When you're sitting on your sit bones and you can feel those bones, usually you have to be in that upright position. So you don't have to have your legs crossed, but I always start out in this position, making sure that I'm feeling those sit bones and that my spine is in really nice alignment. I also pay attention to just dropping my shoulders and making sure that they're sort of drawn back. That has nothing to do with your pelvic floor, but it's just good form, and because we tend to have very rolled in shoulders, it's good for us. So get into that position where you're sitting, you can feel your sit bones, and you can feel that the alignment of your pelvis and your spine is nice and straight up and down. And then you just start with some breathing. I want you to get a feel for what your stomach and your diaphragm feels like as you breathe in and as you breathe out. So take a nice deep breath in and out again. And what you should feel is that when you breathe in, your stomach kind of comes out, your stomach fills up, and then as you breathe out and your diaphragm rises, your tummy kind of comes in. That's the key to engaging your pelvic floor, is the difference between inhaling and exhaling, okay? So what I want you to do this time is inhale and let everything relax. So don't go into this posture, but just be relaxed. And then as you exhale, almost make it like you're gonna whistle something. And what I want you to do as you exhale is feel your belly button drawing in towards your spine. Really what you're doing is you're stretching this whole area out as you're doing that. So just take a few deep breaths, relax as you inhale. So as much as we talk about pelvic floor engagement, the relaxation is just as important as the engagement, okay? So relax, let it go as you inhale, and then as you exhale, draw that belly button in. Do that just a couple more times. And then what I want you to do, I'm going to explain it as you're doing that. Next thing I want you to do is next time you exhale, as you draw that belly button in, I call it zipping up your girly bits. So just lifting, feeling that those pelvic muscles engage. You're feeling that squeezing together. But what you don't want to do, you're not clenching your bum cheeks, or you're not turning your pelvis in as you're doing it. You're just simply engaging. You're feeling that engagement as your belly button's drawing in. And then you let it out as you're inhaling. Bring in that belly button, zip up the girly bits, and now inhale and relax it. And that's all you need to do to engage your pelvic floor. If you spend 2 minutes, 5 minutes in the morning just doing some deep breathing, where every time you inhale, you relax, and every time you exhale, you engage your pelvic floor, you'll get into the habit of what it feels like, so that when we add in some exercises that include pelvic floor engagement, you'll be doing it properly. If you have any questions at all about it, you can put them in the comments. I'll do my best to answer them through comments. If you need to get in touch with me, you can always get in touch with me through my website, elevatewomenshealth.ca, or you can message me through Facebook, or you can just call me, 647-995-1251. You can call me directly and I'll give you some direction. Excuse me, and if there's anything that I can do to help you as a chiropractor, just let me know. I'm happy to help. Have an awesome day.